This video is for informational purposes and not a substitute for professional medical advice. Please consult with a healthcare professional before starting any weight loss medication. Are you worried about the risks of weight loss drugs? The truth about weight loss drugs. What you need to know. Hey everyone! Today we'll be diving into the world of weight loss medications, but before we start, please like and subscribe. Orlistat blocking fat absorption. This medication is a powerful tool in the fight against obesity. Orlistat, known as Xenical or Ali, is a medication designed to help you manage your weight. It works by blocking fat absorption in your digestive system, making it easier to lose weight. Specifically, it prevents about 30% of the fat you eat from being absorbed, which can significantly reduce your calorie intake. Available by prescription and over-the-counter, Orlistat is accessible for those who need it. It's particularly recommended for individuals with a BMI of 30 or higher who are classified as obese. However, it's important to be aware of potential side effects, which can include oily stools and more frequent bathroom visits. These side effects are a result of the unabsorbed fat being excreted. When combined with a low-fat diet and regular exercise, Orlistat can be even more effective. Studies have shown that it can help you lose 5 to 10% of your body weight, leading to significant health benefits and improved quality of life. Phentermine topiramate, a powerful duo for appetite control. This combination medication is designed to help individuals manage their appetite effectively. Phentermine topiramate is a combo medication for appetite control. It combines two powerful drugs to help reduce hunger and support weight loss. Phentermine, a stimulant, and topiramate, an anticonvulsant, work together to reduce hunger. Phentermine increases energy levels and decreases appetite, while topiramate enhances the feeling of fullness. It's prescribed for those with a BMI of 30 or higher, or for those with a BMI of 27 or higher who have weight-related health issues. Side effects include dry mouth, constipation, and increased heart rate. Some patients may also experience dizziness, insomnia, or mood changes. It can lead to a weight loss of 10% or more over a year. This significant reduction in weight can improve overall health and reduce the risk of obesity-related conditions. Liraglutide, from diabetes management to weight loss. Liraglutide, known as Saxenda, was initially used for diabetes management. It regulates appetite, signaling your brain to stop eating. Side effects include nausea and a slight risk of pancreatitis, but it can help you lose 5 to 10% of your body weight. Semaglutide, a weekly injection for weight management. Semaglutide, known as Wegovy, mimics a hormone that tells your brain you're full. It's a once-a-week injection with side effects like nausea and a small risk of pancreatitis. Clinical studies show it can help you lose 15 to 20% of your body weight. Naltrexone Bupropion, targeting hunger and cravings. Naltrexone Bupropion, known as Contrav, tackles hunger and cravings. Side effects include nausea and headaches, but it can help you lose 5 to 10% of your body weight. It's prescribed for those with a BMI of 30 or higher. Setomenotide, a breakthrough for genetic obesity. Setomenotide, known as Imcivree, targets genetic obesity. It corrects imbalances in hunger-regulating mechanisms. Side effects include skin discoloration and nausea. It's a game changer for those with specific genetic conditions. Phentermine short-term weight loss solution. Phentermine, known as Adipex-P or Lamera, suppresses appetite. It's prescribed for short-term use, usually up to 12 weeks. Side effects include increased heart rate and difficulty sleeping. It's for those with a BMI of 30 or higher. Discuss potential side effects with your doctor. Zound, a new player in the game. This innovative medication is making waves in the weight loss industry. Zound contains tirzepatide, a powerful compound that activates both GLP-1 and GIP receptors, enhancing the body's natural ability to regulate weight. It's approved for those with a BMI of 30 or higher, offering a new hope for individuals struggling with obesity. Clinical trials show an average weight loss of 18%, a significant improvement compared to other treatments available. Side effects include nausea and stomach discomfort, which are common but manageable with proper medical guidance. Close monitoring by your healthcare provider is essential to ensure the best outcomes and manage any potential side effects effectively. Weighing your options, making informed decisions. Consult with a healthcare provider to determine the best treatment plan for your needs.